And when you have a situation where a kid is sick at 2 a.m. in the morning or 3 o'clock in the afternoon after they get home from school, they're not feeling too well, what do? Do you pack up the kids, spend a half hour to get to an office and then sit there and wait? Or do you, again, pick up the phone, basically get into a telehealth service, see a physician very quickly, figure out what is needed, get a diagnosis quickly for that child. And then, if it's a prescription, great, get the prescription sent out, potentially even delivered, which is, again, pretty unique from our standpoint. Or if it's basically recommendations of what needs to be done next, that's done. And at least, within 15, 20 minutes, you figure out you've got your problem resolved, or at least going in the direction of getting it resolved. Hopefully your child getting better pretty quickly. And so the aspect of doing that in well under an hour, well under 2 hours, is a huge element that I think, again, speed within our system makes the difference.
Yeah. Let's just walk through like what that experience actually looks like for a parent. Let's say they're trying to get their kid in bed and the kid's not feeling well. They're looking for an app. They're trying to go from getting the app downloaded to diagnosis. I mean, what's that experience actually looks like?
Yeah, I mean, again, if they're looking for help, obviously if they Google My Pediatric Doctor, they'll find us right away. Obviously, if they pull in, pediatric urgent care or pediatric 24/7 care, they'll obviously we'll be showing up pretty quickly on the Google type of search. Once they do that, they come into our system. Basically, they go into starting a visit with the physician. They enter their information into the system. What's great is that we'll have the ability to actually do both fee for service and insurance for that patient. And so they have a choice based either on their copay or how they want to actually access our system. So if they want to just pay fee for service and use their credit card, that's one way. If they do run it through their insurance, we verify the insurance and move them right into the platform. In essence, once they get into the platform, there's what are called intake forms. So basically a number of questions that are asked of the parent. What is going on with the child? What's the, obviously, age, the height, the weight of the child? Are they on any medications? More into, again, if it's a sore throat issue, is it a rash issue? Is it a stomach or tummy issue? Is it a maybe headache issue? All of that information is asked within our intake form settings. Once that's completed, they're put into the portal to see a physician. And basically within minutes, they have basically a conversation either via text if they want it, or video if they would like it, to basically get feedback and kind of the next steps on what's needed for that child.